Hi there, my name is Nick Ray and with me is Dr. Penny Taylor. We're the co-directors of 360Me Nutrition, and we wanted to talk to you today about these weight loss medications that have become increasingly popular, and probably hundreds of thousands of people throughout Australia are taking them now. Some with little assistance from dietary change and behaviour change. So we thought we'd have a bit of a chat just about these medications and the things that we should be talking about with regards to these medications. The media, of course, have been very hot on, Ozempic and the difficulties of diabetics accessing drugs like Ozempic. But of course, there's other weight loss medications now that aren't just for diabetes. So Penny, what do you think we should be talking about?
This is such an interesting topic. So for me, I think starting the medications, often people have forgotten to be told or may not have taken on the information around what they need to do to be supported by the medications. Taking the medication, we know from the media through evidence that these medications do work. They're GLP-1 medications, you might have heard that term in the media, but essentially what that means is that these drugs slow down gastric emptying. They actually help appetite and control appetite, which is great because that means the drugs work. But what it works best with, and what evidence will show you, is that, and not just evidence with weight loss medications, Nick, it's also evidence with what we've done with dietetics for over 20 years, is anything with diet and lifestyle change, you need to be supported. We face roadblocks, and we face those roadblocks of family changes, or we have kids going to school, you're building a family, have a family that you have to work with, or you also might be living alone having these medications too. So having support in any aspects of your life to make sure that you're getting the best out of the medications is important. So just working with the dietitian and your healthcare providers as a team is really important to help you build strategies to overcome these roadblocks. For example, in the initial stages of weight loss medications, you would have found most of your patients get good appetite control, come back to you with good weight loss.
Yes.
Maybe at 3 to 4 weeks, I've seen patients that have experienced, now it's slowing down. What do they do? And there's this fear of less weight loss or the weight loss stopping. And so we're there to help people guide about, look at their diet. So are they slipping back and not being able to pick it up? Or are they doing really well and they've hit a weight loss plateau? They just might need some encouragement or word of advice or start some exercise. So that's what we do. We come and interject and look at those plateaus or look at those little roadblocks that you may face to help you overcome them and get the best out of the medication.
I think that's exactly right. Our 360Me dietitians have all had training in all of these new weight loss medications so that they're fully aware of the potential side effects and the statistics that are quoted of how much weight they can expect to lose, because we want our clients to have a realistic expectation of how much weight they could potentially lose. What do you think is the biggest, most important information our dietitians can give people who perhaps so far are on these medications and haven't actually seen a dietitian?
It's good. Nutritional sufficiency is probably our creed, wouldn't you say? That when you're starting a diet and a diet plan or diet medications, that weight loss medications, that help you control your appetite, you're often reducing your food intake, and that can come with reducing nutritional intake as well, so vitamins and minerals. We want to make sure that you're maintaining adequate muscle mass, for example. One of the key things with these weight loss medications or any weight loss is that you have the risk of losing muscle mass, not just body fat. And we want to make sure people maintain their muscle mass, simply because increased muscle, increased thermic effect of the body. So you actually have better metabolism with greater muscle density. So, it's just making sure that you get in early and understand what nutritional sufficiency means to you as an individual person.
So on muscle mass, how do you know if you're losing muscle mass is a good question. In our clinic here in Adelaide, we have bioimpedance scales which can quite accurately measure body fat, but more importantly, muscle mass. So we can monitor someone's muscle mass who's taking one of these weight loss medications to make sure that we are achieving the goal of it, at the very least maintaining muscle mass, or better still trying to increase muscle mass. But what can people do who don't have access to that sort of dietitian who's got that capability of measuring that?
That's a really good question because it's very subjective otherwise. If you've got the tool that can actually read muscle mass, it's better, obviously. And there's gold standards where we look at, getting a DEXA if you have access, especially if you're having a bone density scan coming up in your today. You can ask for them to do a fat mass on that bone density scan at the same time. But ideally, what you want to do is start taking waist measurements. Just understand how your body feels is really important. Are you getting more weakness in the grip strength? That's one of the areas that we do lose strength in when we're losing muscle density as well, is grip strength. Is it harder to open it? It might be losing weight, looking fabulous, is starting to feel good, but is that jar harder to open? Are you finding you're becoming more fatigued after doing a weight session that you might have been finding quite adequate before? So things like that might be a good trigger for you to go, hang on, I might just need to get checked. It might not be something you need to be worried about, but coming to the dietitian to understand where your protein sources are coming from. One of the key nutrients that we look at for muscle density is making sure you're getting enough leucine in the day. So leucine is an amino acid, and we do require around about 3 grams of leucine a day to help with muscle synthesis. So speaking to the dietitians about prescriptive approaches to getting some of those amino acids in.
And a lot of people are receiving their weight loss medications without a lot of support. We'd like to think at 360 Mean Nutrition that our dietitians can help people, whether they're here in Adelaide and come and see one of our dietitians or through telehealth. Do you think, what's the success of seeing a dietitian through telehealth? What's your experience there?
Well, I personally like telehealth because you can reach a further area of need, so remote areas that may not have access or time to drive an hour or 2 hours or even 3 hours in to see their team. You can get that access via telehealth. Face-to-face is always good because you can read the dynamic a little bit better and help and you build that rapport a little bit better. But I think the way we're moving forward, especially post-COVID, is through telehealth. You do need to be a bit more prepared for telehealth services. You do need to be able to take some notes, and we do provide notes electronically in that way. But it is effective. And what I do love about that learning I did through telehealth is you're in your own environment, you're on FaceTime or you're on Messenger, and you're able to take the phone and show us your fridge, or you're able to sit us down and show us your plates and your foods that you have, or your medications. And I felt that was an additional bonus when I've had patients come into the office. Oh, I forgot that medication. I can't remember the name of the product, and I didn't take a photo of it. You're right there in your home. You can show us everything, if you want to.
Of course. Now, lower carb. We have to talk about carbs. At 360 Mean Nutrition, we do have quite a heavy focus on lower carb eating for conditions such as weight loss, but other conditions as well, where there's good literature to support the fact that lower carb actually helps. How can our dietitians help people with carbs? Because I see a lot of patients who think that they're not eating too many carbs, but once you teach them how to count carbs, and they then soon realise they're having a lot more
the carbs
than they
come
thought.
from.
Yes. And why is lower carb important, Penny?
Absolutely. Look, I've been lucky in part of my career that I've helped write the CSRO low carb diet, and that was a research-driven piece of work to look at lowering carbohydrates to 50 grams on a prescriptive way. However, being in 360 Mean in a practice sense, we look more at translation of that nutrition information. And the benefits of low carb in a clinical practice is we get to personalise that to you. So we lower the carbs. So we may find a patient come in and sit down and they might be on 300 grams of carbohydrates. Some of the patients we see are traditional Italian meals with pasta and rice, and we want to accommodate those kind of cultural qualities of foods and not demonise carbs in those sense. So we lower the carbs. And the benefits of that is we still see the benefits of reducing, especially if someone's got type 2 diabetes or pre-diabetes, we start to see greater glycemic control, meaning people are becoming more aware and more in control of their blood glucose levels and slowing weight loss.
Excellent. I think our dietitians are very good at teaching someone what are carbs and how to count them in a really simple fashion.
And it needs to be simple, doesn't it?
It needs to be simple, and we've got really good resources that help, that can be emailed if you're doing a telehealth consult. consult or if you're face to face, to make this simple. This shouldn't be difficult. It's not that difficult.
Yeah, and to break it down the steps of what people need as well, I find is really useful, because we can tell you what foods we eat and people get overwhelmed. They think of it as a total diet and think that I have to change everything. But what the dietitian's great to say is look at what you're eating as your total diet. So you're already doing great here, or you're doing fantastic there. We just need to massage this little area of carbohydrates. And it is finding out beverages that have carbohydrate in them, or fruit that has more carbohydrate than you think in them, or vegetables. And it's those little areas that they tease out. Most people know to drop the discretionary food, get out the cake, the pastries.
Quit the Coke.
Yeah, people know that. So when they're coming to us, it's more that detailed investigation of the diet.
And what about, I think a big issue, to be honest, with many of these weight loss medications is what happens when you stop them. So what happens when you've done a fabulous job, you've reached your target weight, you're delighted, and you're trying to wean off the medication because it's, they come at a cost, of course. So most people at some stage are trying to get off these medications.
Yeah.
What happens then?
This is probably the most important time to be with a dietitian and team, really engaged, being open and honest about how you're feeling coming off them. They do control your appetite while you're on them, but as you come down off of them and start to titrate, your appetite may return. So you may get the desire or the willingness to have some other foods that you may have excluded from your diet while on the drugs. So it's really important to come down off them slowly. In some cases, people may be on them long term. It might be something that you look at lowering the dose to see where your true effect is for stabilising your weight, and you may be on them long term, but not at the dose that you were at a maximum level.
For the loss. Yeah. But certainly we see, lifestyle and diet changes being critical to ongoing maintenance of a new weight, that someone has achieved. So again, I think if you engage in seeing a dietitian and you're doing well with exercise, you might have seen an exercise physiologist. They're the team players that Penny's talking about to try and help people maintain their new fabulous weight that they've worked hard to get to.
Absolutely, and it's being realistic about what sustaining weight loss means to you as well. And I think being with a psychologist and the team that has that behavioural lens on them, not just focusing on diet, not just focusing on exercise, but the whole totality of the person and what they do in their lifestyle. You might start off doing 5 sessions at the gym a week, or going for runs and cutting back on all these foods and not going out socially, but that's not sustainable. It works, but it's not sustainable. So we want to work with you to work with what's going to be sustainable in your life and transition you to that way of eating or that way of living.
So if you're on these weight loss medications, or you're considering starting these weight loss medications, what can they do, Penny?
Well, first of all, obviously call us, but before you do that, just work out what your goals are. What do you want to achieve, and how can we help you? Then call us and we'll work with that.
So if you want more information on 360 Mean Nutrition, go to our website or call our 1300 number, and you'll be able to see one of our dietitians who can help with all these things that Penny and I have gone through with you today.